Good morning, all. It's Becky. As promised, what I'm going to be doing is going through a series of topics that is directly contributing to the demise of our medical system. Now, before I do want to stress this fact. The medical system isn't 100% terrible. Those on the inside, such as your doctors, your providers, your nurses, your medical assistants, your receptionists, all have your best interest at heart. It's just what the political side, such as the insurance industry, the pharmaceutical industry, is making it very hard for us to do so. Most doctors, nurse practitioners, physician assistants, we all go into getting our degrees with the best of intentions. I hear so many people out there say, oh, they're just in it for the money. They don't care. That's furthest from the truth, for most anyways. There are so many careers that we could go into that make similar money, but we choose to go into the practice of medicine to help people. Unfortunately, they are seeing over time that their goal is unattainable and unreachable. Not because they don't want to, but they just can't. There's so many variables that hold them back from doing so, one being the insurance industry. But that's a whole nother video. Today's video is all about what is happening as a result of providers trying so hard to help, but not succeeding. That is provider burnout. Now, I'm not here to BS anybody. And because of that, I've done a lot of research before this video, and I will do a lot of research before every video. I want numbers, I want research-based proof of what I'm talking about, and I will be doing so in each video. But before I do, I'd like to open this up more with something more lighthearted, because these topics are pretty serious and is affecting many people across the United States. What I would like to do is open up with a little joke at each video or something that's a little lighthearted. And the one I found today were basically Jeff Foxworthy type jokes. You're a blank when. These jokes are, you're a doctor when. This was written by Dyke Drummond. He's a doctor. And I'm just going to go over a few. You're a doctor when you know some of your patients better than your own family. You're a doctor when you think you really want to, when they think that you really want to see what's coming out of your nose or elsewhere. You're a doctor when you have to decide whether eating or going to the bathroom is more important because you don't have time to do both. You're a doctor when you can sleep standing up. You're a doctor when your children look at your spouse and say, "What is Daddy doing home?" So let's start getting into some numbers. Again, everything I'm doing is based on research. So you'll see me reading a lot because I want to get the numbers out there accurately. So did you know that of 2022, there are approximately 1,073,000 physicians in the United States? 10% in California alone. The average panel or physician panel, provider panel in a practice, so what that means is how many total patients are under that physician in the practice. So the average number is between 1,800 and 2,000. Give or take. The average number of patients that a provider sees in a day is 20, 50 or 60 in the urgent care setting. To break that down, that is 2 to 3 patients an hour in an 8-hour day, or 4 to 5 patients an hour in a 12-hour day in the urgent care setting. 50% of provider visits is related to chronic care management. What I mean by that is taking care of illnesses that will likely be with you for the lifetime. Illnesses such as diabetes, hypertension, congestive heart failure, COPD, asthma, obesity, and the list goes on. You will notice that each provider visit, we talk a lot about preventative visits or preventative services, such as your colonoscopy, your mammogram, your pap test. Why do we do that at every visit? Well, it's not only because we care, but it's also because it's part of insurance reimbursement. Insurance reimbursement is so low today that if we plug that in at each visit, we get a little extra money. Did you know that 1/4 of the time of what needs to be accomplished with your visit is done face-to-face? In the United States, the average amount of time the provider spends with the patient is about 9 to 21 minutes. Let's talk about a prime example of a typical patient visit. You come into your 10 a.m. visit at 10 a.m. This visit is on the provider's schedule for 10 a.m. But you will not see the provider at 10 a.m. First, you must see the nurse or medical assistant who will take you back to your room and ask some questions, do your vital signs such as your blood pressure, your weight, your heart rate, and your temperature. This 5 to 10 minutes into the allotted time for the provider to see you, which takes about 15 to 20 minutes total. So this leaves us with about 10 to 15 minutes to do the following. We must find out and expand on what your chief complaint is. However, many times, patients come in with more than one chief complaint. Heck, I don't blame you. Who wants to go to the doctor more than once? Who wants to spend the money for the gas or the co-pays or just waste time? But please understand, this all takes time. What do you mean by expand on? Well, let me tell you. You're going to get a lot of questions from the provider to expand on what is going wrong. This is called history of present illness. For example, you come in with shoulder pain. We will ask you things like, when did it start? What were you doing prior to it starting? Describe the pain. What makes the pain worse? What makes it better? Have you had this pain before? Have you ever had an injury to that shoulder? Etc., etc., more questions and more questions. This all gives us a clue of what might be going on. After that, we'll perform a physical exam based on your complaint. However, if you came in for a full physical, we'll do a full physical. But have you ever noticed that the exam has changed over time since back in the day? What the provider looks at, what the provider listens to, palpates or touch has become less and less over time. It's not an excuse, it's time. We must discuss our diagnosis or what we feel is going on and make recommendations, teach, discuss prescriptions, and discuss your follow-up. But there are times that patients also come in with things like an abscess or a laceration that needs to be sutured. So that beats that 20-minute time frame that we have to see you. That extends it to probably 30, 45, maybe 60 minutes that we are with you. What do you think happens to the patients that are waiting after you? You got that right. They wait, and they wait, and they wait. Remember, the more complaints you walk in with, the more recommendations, the more teaching, the more possible prescriptions that need to be discussed, the more time. Are you thinking, that's not that bad? Well, remember that I told you that 1/4 of the time of your visit is spent face-to-face? Well, let's talk about the other 3/4 and 75% of time. Hold your breath. This is what else we do that pertains to your visit. We send in new prescriptions or we send in refills that are needed, but when refills are needed, we need to go into your chart. We need to read the chart and see, do you need this refill or do you need a follow-up to discuss the refill? We send in orders that you may need, such as labs, radiology, etc. We are filling out forms. such as leave of absence forms, insurance forms, other forms. We are sending in referrals. So say you come in, your provider says, okay, you need to see a cardiologist. We have to send the referral over to the cardiologist. That all takes time. We're reviewing notes. We're reviewing specialist notes. So after you see that cardiologist, they have to type up or send over their notes, and we need to review them. Now that doesn't always happen, so sometimes we have to reach out to the specialist to get the notes to be sent over so we can review them. We also review notes that you come in with when you first start with the practice, so we can read about your history. We are returning patients' calls, we are dealing with insurance claims, denials, etc. We are speaking to specialists. And lastly, and mostly, we are finishing your note. That note that we have to complete in order to save to be part of your chart. These notes are conducted in an electronic medical record. Now let me tell you, these electronic medical records aren't perfect. A lot of times they have a lot of flaws and or they stop working. Yes, we do have staff to help us with all of this. However, no office is perfect, absolutely none. And let me tell you, without the staff support of the nurses, the medical assistants, and the receptionists, we would have been burnt out a long time ago. So because of all these things that we need to do, it is researched that the average number of hours that a provider works in a week is over 50 hours. Are you stressed with hearing this? Your provider sure is. They want to help, but they need to take care of their own health as well. This demand on providers is leading to medical error, emotional exhaustion, diminished sense of purpose, diminished sense of personal success, substance abuse, PTSD, depression, poor physical health, and yes, you guessed it, suicide. The statistics of suicide in America, 12 to 13 out of every 100,000. That number increases to 28 to 40 out of every 100,000 in providers. Why do you ask? Like I said prior, most all of us go into spending the $200,000 or more to get an education with the hopes of helping society. However, the system is making it harder and harder to do so, which in turn results in providers feeling like they failed the patient, when in all actuality, it is the system that's failing the patient, not the provider. Because of this, it is reported that 25 to 60% of providers have reported being burnt out. And 1/5 or 20% have reported that they are going to leave the practice of medicine. So did this question cross your mind? So why doesn't providers and physicians just see less patients? It's not possible. Why? There's a few. One important one is that if we did that you would wait months before you get to see your provider. Remember, the average number of patients a provider has in his practice is typically 1,800 to 2,000. Now the second reason falls back on insurance reimbursement. Remember that $250 bill that you got that we had to submit to your insurance for reimbursement? Well, do you think we get $250 back? No. They reimburse about a half of what is charged. So that's being $125. So if a physician or provider saw only 10 patients a day, their income would be $1,250 in the day. $1,250 to pay themselves, hold up the practice, pay their employees, and purchase equipment. So to just make it, we either have to, 1, see more patients, or 2, hire more providers, or both. So does this give you an inside perspective of what's happening every day in your doctor's office? Can you see why this is definitely contributing to medical error? And I'm only starting. Now, I do ask of all of you, I want your opinions, I want your thoughts, I want your stories, I want to know what's happening to you in your doctor's office, positive, negative, both. So please comment. So until next time, thank you.